I'm very excited to announce our speaker today. Dr. Mankey is a board-certified child, adolescent, and adult psychiatrist who currently practices in Austin, Texas. After graduating from Harvard Medical School, Dr. Mankey was a resident in its affiliated psychiatric training programs at Massachusetts General Hospital and McLean Hospital. He completed both adult psychiatry residency and child and adolescent psychiatry fellowship at these institutions. He then accepted a faculty fellowship with MGH's Parenting at a Challenging Time program, a specialized program that provides parent guidance to families in which parents have cancer or other serious illnesses. After completion of this training, he continued his work with the PAC program at MGH and was on faculty at Harvard Medical School, where he was nominated for numerous teaching awards. Dr. Mankey moved to Austin, Texas in 2010 to be closer to family and currently has his own practice.
Great. Thank you, Ethan. Welcome. I'm so glad to see you all. I'm glad that you're here and that I have the opportunity to share with you and to think with you together about this topic of parenting with cancer, and specifically to think with you about how can we promote resilience and good coping in kids as they go through the challenging course of a parent's condition. So just a couple of acknowledgements. Ethan already kind of described how I got into this area. It was at Massachusetts General Hospital's PACT program, and the whole purpose of that program is to provide parent guidance to folks who have serious illness and are wondering how they can guide their kids through that illness, and specifically cancer is the main thing that we work with. So I want to recognize Dr. Paula Rausch, who did some of the groundbreaking work in this probably about 12, 13 or so years ago was when it first got started there. And some of the other members of the PACT program when I was there are listed above. And one of the things that I did as I worked with the program was help to create the website that's up here, which will hopefully be a valuable resource for you all going forward. There's a lot more detail about some of the things that I'm going to cover somewhat quickly today, and you can get on there and read them in more detail. So also just to mention that this talk is adapted from a previous one that I did at the Dana-Farber Cancer Institute, which is part of a CME for clinicians who work with folks who have cancer. And I adapted it today to be specifically to parents because I think the topics are important ones to share directly with you. One of the other things that I'd like to mention that unfortunately I did not put on my slides, but we'll have a chance to hopefully talk about, and I see Kim Fry here from Wonders and Worries, is we have a great local resource here who does a lot of this work here in town, and they see kids and parents, and we can talk more about that later on. So in terms of what I'm hoping that you can take home with you from this talk, you'll notice that the graphics are on purpose kind of childlike because I really want us to think and put ourselves in the mindset of kids as we go through this talk, kind of going back and forth as parent and kid. The other thing is I want to attach some of these symbols to some of the key topics. So this is what we're hoping to learn today. So one of the things that we'll do is really talk about how parenting with cancer is actually a very common challenge. Often we don't hear a lot about it, and there's not a lot of talk about it going through even the whole course of treatment unless you bring it up or others, some clinicians will do that, but it's actually a very common thing. We'll also describe a framework and hopefully you'll be able to describe the framework after the class to consider the unique parenting needs of each child during a parent's illness. Certainly every family is unique, and each child within that family is also unique, and we can think about some of the ways to think about those qualities. In addition, hopefully you'll be able to list some key principles that you can use to encourage coping and resilience in children. And you'll be able to determine when a child may need more additional services besides the support of the family. So in terms of the scope of the matter, there is a recent study that showed in a 2-year period, 18% of people diagnosed with cancer within that period actually have minor children at home still. And 14% of all cancer survivors are still parenting minor children, affecting close to about 3 million children in the United States. So again, this is a really pervasive issue that we're talking about. And these numbers do not include children over 18. And for those of you who have young adult children, many of you know that they still need a lot of parental support and guidance throughout their young adulthood. So those who are affected by a parent's cancer are many. Also, the American Cancer Society says that 23% of all cancers are diagnosed in adults less than 55 years of age. And as the trend in our society becomes one in which parents are having children later, I think the numbers that you see above are just going to continue to climb. So here's one of those childlike images that I want to point out. And it's really for the concept of the uniqueness of families and children within families, what we'll talk about now. One ways in which families are unique is that each family has their own illness history, and not just within the family, but intergenerationally. For example, a parent who is diagnosed with cancer may have had a parent themselves who had cancer, which then may affect their experience, their understanding, their thoughts or assumptions about what it will be like for their child. And certainly that's a different situation than a family that had not been affected by cancer in the past. Then each child also has a different experience with illness, him or herself, or illness within the family that they have seen, even if it was before cancer. And so understanding what their experience has been already can be a really helpful piece of knowledge. So then we want to get into the unique qualities of each child within the family, because as you know, as parents, kids think differently and operate differently and are preoccupied with different things and are supposed to be doing different things at different ages. And that obviously affects how they think about, how they understand, how you talk to them and communicate with them about your cancer. Temperament is another variable that we often think about. Temperament is kind of the precursors of personality in a kind of a rough statement. It's not exactly true, but roughly speaking, kind of, is your kid flexible, adaptable? Are they kind of outgoing? Are they sensitive? Do they have a lot of intensity behind them? Are they easily distracted? And those sorts of things. And certainly that can affect how a parent or how a child copes or deals with and communicates about a parent's illness. And then also we want to think about each child's usual way of communicating, because certainly that can be different. And specifically communicating about hard topics. You know, some kids really don't like to talk about them at all. Some kids prefer to be left alone. Some kids like to draw. Some kids like to write about it. And just kind of keeping that in mind. How have they dealt with things and communicated about things that have been difficult in the family prior to the illness? It can give you some insight into what might be some useful roads of entry, you know, for really communicating about this. Thinking about each child's coping history, you know, how they have handled prior difficulties before, their prior level of functioning, and any specific concerns that you already have about your child is also really important as you think about how to share the news and help them cope throughout the course. One thing that's really important is to realize that of all the people you may come into contact with through the course of illness and survivorship, that you really are the biggest experts on your children. You have known your children the longest. You know all the intimate details about how they think and what they're like and what works and what doesn't for all the other things. And so keeping that in mind and finding people who can help to support you and pull out your knowledge of your kids already and apply that to this circumstance can be really helpful. So some key parenting principles that hopefully will be really useful as you think about your children during this time is, number one, communication. There's the telephone to remind us of that. We want to facilitate open and honest and age-appropriate communication from the beginning as much as possible. And if that hasn't happened yet, it's never too late to start. That sort of communication is essential for kids to do well through this course. Also, protecting family time is really important because we want to, as much as possible, you know, obviously cancer can change many things in a family's life, in a day-to-day life, but as much as possible, we try to carve out sort of islands of normalcy for children, and protecting family time is one of the ways that we can do that, and we'll talk more about that. Maintaining structure and routine is often very helpful for children as well. All kids, including adolescents, do better when they know what to expect, but it's certainly even more important for young kids and infants who have things like feeding times and nap times and that sort of stuff. Keeping all of that on schedule is really important. And then we'll think about optimizing and organizing your support system, how to do that and how to incorporate that into family life. So communication. One of the things that, when a parent is diagnosed, one of the concerns or questions that is often brought to us is, do I have to say anything to my kid? I'd rather just not say anything, because there's a natural instinct to protect the child. And there can be a thought that maybe we can do this without them ever finding out. Again, it's a very normal, natural parental instinct to want to do. But what we find through both research that looks at how kids do and what helps kids do well, and through our clinical experience working with kids and their families, is that children are really keen observers and they're really good listeners. And you probably know that already, because if you have a kid as old as a toddler, you know what sponges they are, and they just really soak everything up, and they're always watching and they're always listening, even when you think they're not. So keeping that in mind is really important. And then really, if you think about it, given that kids are such good learners and observers, everyone really deserves to know why the changes that they're witnessing are occurring, because it can be very confusing for kids if they don't have some sort of story or narrative to put to all the stuff that they're seeing that's different around them, even if that's as slight as a parent's tone of voice, or a change in the time mom wakes up, or the change in the time that dad goes to sleep, or what dad can and can't do around the house. Any little thing, kids are observing and wondering why. So the other aspect of kind of that not telling is that many people will be talking to you about this and overhearing a conversation in which you're telling someone else about it, and you use the word cancer, or you just talk about an upcoming appointment or something gets missed, will often cause hurt feelings in the kid, or other feelings of, maybe this is a big secret and I'm not supposed to know and I'm not supposed to talk about it, and then that leads them to worrying alone about it. So we really want to avoid worrying alone and to avoid overhearing because of how hurtful it is. So we also want to avoid these errors of kindness, as we call them, because the intentions are great, but over time we've learned that it really does kids a disservice, and actually more kids are anxious if they don't know the truth. So another key topic is the open, honest, and age-appropriate of sharing information, and we'll get into this a little more. And this reminds me that the things like boo-boo and cold and sick and bellyache and headache are words that we use all the time in daily life with kids to explain things, to explain illnesses. And using those words, the same words for all those common things, to describe what a parent has is really confusing, and often can be an error of kindness, like we talked about already. Using the word cancer is really what's recommended, because it really separates it from some of these other common things. So if you say, I have a headache, I can't do something today, and they see you going to the doctor twice a week, and they see you feeling sick at home when you come back, then they think, next time I get a headache, am I going to have to go to the doctor that often? And that sort of stuff, especially little kids that you would opt to use these words with in the first place. So we say use the word cancer, and even use the specific kind, because they may have heard on the nightly news or with a friend's parent that they had a particular kind of cancer, and so if they hear that you have a different kind, then they may not rush to assume that it's going to be the same. And you can, even if it's the same kind, you can help to clarify that everybody's cancer, even the same kind, is different for different people. So this is to talk about communication gaps. We have the age of cell phones and iPhones, and kids these days are talking to each other and to parents often very differently. And we want to just be aware of how kids communicate. And it's not just kind of an age gap or a generation gap, but it's also a style gap. As I mentioned earlier, that some kids like to do communication in different ways. Now, I'm not suggesting that you text your children about the fact that you have cancer or that the co-parent has cancer. Certainly you want a sit-down conversation, especially for that initial conversation. But if you have a child who never has liked to talk about hard things, can't stand looking you in the eye when it's something sad or stressful or that sort of thing, then after that initial conversation where some of that work is done, talking with them about how would you like to have more information as it comes along? Would it be better if we talked while you were in the car in the back seat and you didn't have to look at me? Or would it be better if we kept a journal and you could ask me questions by writing them down and I could respond to you that way? Or what would really work for you? So that's what this slide reminds me of. Continuing with communication and our telephone here, one of the things when you're ready to sit down and have that sort of initial conversation, we recommend that you really start by finding out what the kids have already observed, what they already know, or what they're thinking about some of the changes that they're witnessing. And then to go ahead and validate that, to say, you're right, that has changed. It's good that you noticed that, and that's one of the things that we want to talk about. It's really reassuring to kids that they know that now it's going to be explained, now they can understand some of the things that are going on. And then as you're having this conversation, it's really important to kind of monitor emotional expressions during the conversations. Both the kids' emotional expressions, because you often want to try to match that and understand it and lean into it a little bit, and your own. If you're at a place where some of the emotions are really raw and extreme, which of course they will be, as you're coping with it yourself, then it may not be the best time to have that conversation. You may choose to wait till the next day or a couple of days from now when you feel like you could moderate some of those strong emotions. That doesn't mean you should show no emotion though, and that's why I say to monitor them, because I think showing some emotion and some sadness or even some anger or irritability around it, frustration with it, can be a really helpful thing for kids to see, because it models for them that showing emotion is okay and that we can talk about emotion, we can tolerate emotion, even though it may be really hard for us to see our kids cry and in distress about it. Letting them do that in front of you is the best place for them to do it. And then you're ready to share age-appropriate information. What do I mean by age-appropriate? Well, kind of getting back to that idea that kids think differently at different ages, and I'll give an example of that pretty soon. Also, if this is the initial conversation where you're talking about the diagnosis, it's also often useful to give a brief summary statement at the end of what the plan is, because that can be really reassuring that, even if you're just getting tests right now, letting kids know that you're going to the best doctors you can find, you're getting the right test for what this is, and you're going to get the best treatment for it that you can. It can be really reassuring so that they feel a sense of security that even though you may be sick, that you're still handling things, you're still on top of it, and you're going to do everything you can. And that has been something that children, even after losing a parent sometimes, have shared with us as one of the most helpful things for them, that they knew their parent did everything they could. Anticipating future changes is also a really important thing. So if you're going to be in the hospital for a week, and you can plan ahead for that and let the kids know that. If you're going to have a change in your physical appearance, letting the kids know about that and giving some explanation about why that is can be really important. So sometimes you think about, if you're surprised at your birthday party, and that sense of kind of shock that can happen and some emotions that can follow that, and that's a good surprise. But if you're concerned about your parent already because they're sick and then they come home with no hair or something that's surprising like that, that can be more upsetting. Whereas if they knew, and sometimes we recommend taking kids with you to cut the hair together. Sometimes kids like to do it too. There can be lots of kind of creative ways to anticipate changes together, plan for them together, and explain what's going to come. Another concept is pacing information appropriately. And what I mean by that is, you know, all of us need time to digest what is going on and what some of the changes will be and what the course is. And the course itself is an ever-changing one throughout the course of treatment. So I think trying not to overwhelm children and even young adult children all at once, and you may notice even that your doctor sometimes seems to be giving you bits at a time, and sometimes that's because we only know bits at a time. And so trying not to give a whole potential longitudinal course of the illness is important for kids, just kind of as it comes. Another topic in communication is what can happen within a family. So do people know what team this is here in the orange jersey? Anyone want to help me out with that? Shout it out. Longhorns. Okay, I am in the right city. So what team is in the white, though? Same team, right? Longhorns. I picked this slide purposefully because it had members of the same team facing one another across the line of scrimmage. And when frustration and stress is high, it can so often happen in the family that families get divided around a particular stress. And really what I encourage folks to do is to keep in mind that they're on the same team and to put the jersey colors all the same in the family, to kind of link arms and put on the other side of the line of scrimmage the cancer, because that's the real foe. That's what's responsible for making the changes happen in the family, for causing the frustrations there in the first place, and even getting mad about it together and feeling strong together against it can be a useful thing, a show of solidarity in the family. So another thing that we want to do while we're communicating is to welcome all questions and feelings warmly, and even negative feelings. As I said earlier, those feelings are natural, obviously, and leaning into them, trying to understand what your kid's feeling and why they're feeling it can be a really useful tool. So not trying to make the negative feeling go away right away, tolerating a little bit, asking some questions, and also sharing some of your own in a moderated fashion can be useful. Another thing that can happen sometimes for families is that we as parents or other adults in a kid's life when a parent has cancer can think that, oh, they're having a bad day, they must be upset about my cancer. When really, growing up is hard, period. You know, there are a lot of challenges that come kids' way every day, and not all distress is illness related. So we don't want to start there if our kids had a bad day or if the teacher calls and says, you know, Johnny acted out today, that we don't want to assume that. We want to just start by asking them like we would, what happened? What's going on? Can you tell me about it? And through all of this communication, we can really help kids to experience a parent's illness as a challenge versus a trauma. A challenge is when something is hard in life, but a kid feels equipped and ready and supported to handle that hard stuff. They don't feel alone with it, and they feel like they understand and know what's going on and know where they're going to go. A trauma often happens, though, when a kid doesn't feel that way, when they do feel alone, when they're not talking to anybody, they don't know where to go with it, their level of anxiety is really heightened, then it can be a traumatic experience. So those are some of the things that can modify how a kid experiences it. And then I told you to welcome all questions warmly, but what if they're really hard questions and you don't know how to answer it? What do you do? That happens all the time. It happens to me, and I've done this work for a long time. And this phrase is really helpful and it's really meaningful to kids, which is, I don't know. That's a great question. I'm going to look into it. I'm going to ask X, Y, or Z and get back to you about it. And little kids often love that because they feel like, hey, I asked a good one. You know, you and mom and dad don't know. But the fact that you're hearing them, you're understanding that it's important to them, and then actually circling back and telling them goes a long way for kids. This question is a question that is often one of the hardest for parents to answer. Again, as I've mentioned before, starting, if a kid asks, are you going to die? Starting with a question of your own is often the best place to start. Because really, when a kid asks, are you going to die? We really don't know what they mean. We know what we think about when we fear, are we going to die, or is my spouse going to die, or my significant other? We know all that that means to us, but we don't really know for the kid who's asking the question. And oftentimes younger kids really mean, you know, who's going to tuck me in if you're gone? That's all they're thinking about in that moment. So starting with something like, you know, I'm glad that you asked me that. It sounds like you're really thinking about it, but can you tell me what got you thinking about it? Often you can answer that particular question, and it's really not about all the stuff we assume it's about. So keep that in mind. With older kids, if it really is about that, you know, about some of the stuff that we think about of loss and not being together as a family and missing important things, you know, with adolescents who get death in a more adult way, one of the things that we often recommend to parents is to carve out some time of safety for kids. So, for example, a senior in high school says, you know, hey, are you going to die? And really, their high school graduation is like a month away, and that's really what's on their mind, and you find that out. And you may not know the ultimate answer to that or the whole timing of it, but if it's true that you're not worried about that and your doctors aren't worried about that at all for that coming month, then that's a great thing to say to the kid, that no one's worried about that for the next month. You know, we're sticking with the plan as I've told it to you, and I'm going to let you know if something changes with that. You'll be informed. So going through the illness course, another thing that's really protective for kids and builds coping and resilience is protecting family time. And how we do that is parents can set aside cancer-free time by limiting illness-related discussions during family time. So this is kind of cancer-free zone. We're not going to be talking about it. We're not going to let anybody else talk about it who calls me. In fact, I'm going to not have visitors when the children are home, or at least limit them as much as I can so that the house is not always filled with talk about it. Again, trying to create some of these islands of normalcy for kids. And also limiting phone calls during dinner time is really important. You know, one thing that shows up time and time again in some of the literature that I read as a child psychiatrist is how protective family dinner is. And we don't really think a simple thing like eating together can be so amazing, but the data shows that parents and children, you know, children that have family dinner on a routine basis use less drugs as adolescents. Less drugs as adolescents. They get better grades, and there's a whole host of other things that that family dinners can protect kids for. So sometimes I've even taken out my prescription pad and said family dinner 4 times a week, just to point out really how important that is. Maintaining family rituals and routines are important. So rituals are things like Friday night pizza night or movie night or whatever it was that you did before cancer entered the family's world. Doing as many of those as possible can be really important. It builds that sense of home, that sense of cohesion. All of that can be really settling for kids and make them feel like the family is still intact. And for things that have to change, think together or with other professionals, et cetera, about some creative ways that you can still spend some of that quality time. So if you used to go shoot hoops with your son every night and that's the way you really bonded, but can't do that because you're so tired after chemotherapy, thinking about, well, how else can I spend that same time with my son through a different activity? Can we read together? Can we watch a movie together? Can we watch our favorite basketball team on TV that we, you know, DVR'd and all that stuff? So why do we try to maintain structure and routine? Well, one of the main reasons is because predictability is really helpful for kids because it decreases anxiety. Knowing what to expect, you know, imagine if you show up to work the next day and the whole place has changed and you have a different boss and all that sort of stuff. It's really unsettling. And to get your mind around that takes quite a bit of time, and there's distress involved. But if you knew that shift was happening, you met your boss many times already, you felt comfortable, then it's less of an ordeal. So as much of the structure and routine that you can follow, the better off your kids will be. And some of the things that create that predictability are things like meals, bedtime, chores that were done before, prior roles that kids had, kind of keeping some of that the same. You know, participation in school is a part of some of that, extracurricular activities and social life. You know, one thing that is hard is sometimes roles change in a family once cancer is a part of family life. And some of that has to happen. Some of the things that the ill parent used to do and can no longer do has to shift somewhere else. Some may fall to the wayside and be okay, but some of it will have to be picked up. And the co-parent often is the first person who takes on some of that, as is older children. You know, adolescent children often are asked to pick up some of those roles, and that's okay, and it's natural, and it's a good lesson that, you know, families all chip in together when help is needed. However, we ask that parents keep in mind that the adolescent is still an adolescent and still a kid, and tries to minimize or at least explain some of the changes that are necessary and promote some of this typical kid activity as much as possible. So if a child is not able to do all the things they used to do because of the changes, then we say fewer better is a better way to go. So take out maybe one of the sports instead of having all three, and they can increase their attendance and keep it up, and, you know, do better at what it is they are doing. And we talked about role changes, and in addition to being mindful of the changes that happen, talking about them and discussing them and how your kid feels about them. Is there one that's really bothersome that someone else could do, is an important discussion to have. So we also want to think about supports, because we can also help to protect kids if we get more support into the family. So some of that role shift may shift to other adults who are in your life and who are ready and willing to help, instead of it going on to the kids. And I asked parents to gather their supports first and to really think about that, because when you're doing well, your kids do better. And so sometimes it's really hard for us as parents to admit we need help and to go ahead and ask for it. But I think that is also a really important lesson to model for children, that sometimes we all need help and it's okay to ask for it. And by watching you do that and do it effectively, your kids can learn to do that themselves when they need it, which will be good for them going forward. So you want to identify your current supports and then think creatively about additional sources. You know, sometimes when you sit down and be like, here are all the things I don't feel like I can do that I used to do, and things that I need some help with. Here are the people that I know who are already on my team who are going to pick up some of this. Here are the gaps. Where can I fill some of these gaps? Who else can help us? So sometimes the medical team that you're working with knows about resources, has some right on site. Sometimes community resources are available. So here at Livestrong, obviously they're a huge database of local resources, so tapping into that can be helpful. A place like Wonders and Worries, as I mentioned, is also a great community resource here in the Austin community. Then what about if you have too much help? Do you have people calling all the time saying, I want to help, what can I do? Can I bring a meal over, etc.? That itself can become a full-time job and can be overwhelming and can really cut into some of that family time. And so we suggest trying to organize that and outsourcing the organization into one of your most trusted compatriots, whether it's a family member or a friend. But designate a captain of kindness. That is the person who knows the people who want to help and knows what you need help with and knows your schedule and can coordinate it. So that if someone calls up and says, hey, what can I do? Say, thanks so much. I'm really glad. I'm happy to have some help. We definitely need it. Can you contact so-and-so? They're organizing it all for us. And most well-wishers are more than happy to do that. Also designating a minister of information, that's someone who is the primary person who's going to give updates for you as the course of treatment progresses. That when you come back from the doctor, you call them and talk to one person, and they might draft an email to the people on your listserv or blog, or just start a phone chain if people aren't into the computer stuff. But there are lots of ways that you can decrease the amount of information that you have to pass along and designate someone to help you with that. Also, websites can be really helpful. There are some websites now that you can schedule in, and people who are on your team of supporters can actually have a login and go to your schedule and see what the needs are and sign up for those, and that's another possibility. So in terms of the support for children, as I mentioned in the last slide, that when you're doing well, your kids do better. And you are definitely the biggest support for your kid. You always have been, and you will continue to be through this course. They will look to you first oftentimes. So, often parents will ask me, well, I was just diagnosed, should I get my kid into a counselor right away? And depending on the kid, that's not often necessary, because if you can provide the amount of support and you have this open, honest communication, and you do some of the principles on here that we've talked about, your kid might do just fine and not necessarily need professional support. But what happens if your kid doesn't really want to talk to you for any myriad of reasons? Say they're a teenager and they're in that developmental stage of trying to push away from you, which is normal. They may not want to talk to you about it. Also, kids may not want to talk to you about it because they might worry you have enough on your plate. They don't want to worry you with their worries. So they just will keep it inside. So if your kid is having a really hard time communicating with you at all about it, consider people in their lives, other trusted adults who they may have already had a relationship that they might go to before they would come to you. And then with younger kids, having consistent caregivers is really helpful. One of the things that toddlers and infants are doing is really forming attachments, and they're kind of learning how to navigate themselves based on their feedback from the grown-ups in their lives. And so having one or two that it can be predictable people for them often helps to decrease the confusion that the younger kids might have. And then having a schedule of helpers who are going to come into the home can be useful. Sometimes I ask families to put up a whiteboard on the refrigerator, and the schedule for the week is up there so kids can check on it routinely themselves, and they have a real sense of predictability. And if it's changed, it's mentioned that it's changed, etc. And then what about the other people in your kid's life? People wonder sometimes, should I tell the school? I don't really want to tell the school because I don't want it to be a focus of the school. But do I need to tell the school? So we do recommend I recommend that you proactively inform the important people who need to know. But that while you're doing that, you also provide them with some guidance about how you want them to interact with your kids now that they know this information. Because some very well-meaning professionals, for example, just picking one, maybe a teacher who has contact with your kid every day and may really love your kid and wonder about them and worry how they're doing. So ask them, how are things going? Are you doing okay? How's your mom doing? And again, getting back to those islands of normalcy, that may not be good for your kid, actually. So you may guide them, and you might ask your kid, what would be helpful? I'm going to tell your teachers this, but I want to hear from you what would be helpful in terms of checking in with people at school. Do you want any check-ins? Should they just call me if they're worried? Do you want a once-a-week check-in? That sort of thing. So when do we know if these sort of usual supports, your support and those already in their lives, are not enough? Well, if a kid has changes in their attitudes, their moods, their behaviors, their functioning for a matter of a couple weeks or so, that's probably saying that they're not supported well enough yet. And what I mean by functioning, if their grades start to slip or if they're just not really engaged in their sports or anything like that, then people will be picking up on it, and you'll be picking up on it, and you might say, hey, it sounds like there's a bigger issue here. So where do you go if that's the case? Well, one other thing to think about, a couple other things before we get to the where. We're still on the when. If your child has a pre-existing condition, like they've had depression before, or they have anxiety, or they have ADHD or problems in school already, keeping an eye out for a worsening of those things is also a really good sign that some professional help may be needed. If the kid asks for support, I think that's a no-brainer, because it's rare that kids will actually do it. So it means that they are wanting something more and they need someone else who maybe is not in the family to go to. That came in a dramatic way on purpose, because risky behaviors or other safety concerns are emergencies, in my opinion, especially if a kid is saying that they're so distressed or distraught that they're thinking of ending their life. Certainly we want to get them attention immediately. And where do you do that if safety is a concern? The best way, if you're really worried about their actual physical safety, is to call 911 or take them to the emergency room where they have mental health treaters there and ready to do an evaluation and to think about what support would be best for your kid in that moment. That's fairly rare, but obviously can happen for some kids. And when it's less acute than that, when it's not as serious, then people like school counselors, therapists in the community, child psychiatrists like myself, et cetera, are often places you can turn to for evaluations and maybe some therapy or ongoing support. And so where do you find therapists, et cetera? There are lots of places to start. One is their pediatrician. They often know mental health providers that they have referred other families to. Your insurance plan, if you have insurance, to call them up and say, hey, I want a therapist for my child who's on our list. They can give you people right in your vicinity. The child's school counselors or teachers may know of resources in the community, and also community supports like LiveStrong and Wonders and Worries, and folks who help kids all the time. So in conclusion, some of the main things that we covered today is that many people with cancer have children at home. So this is a really common concern. But even though it's common, each family and each child will deal with this in a different way. So we want to keep that in mind. Also, things like a child's developmental stage, their temperament, and their own history and maybe pre-existing conditions are important considerations as we think about how to help them cope. In addition, some of the key principles that we talked about were communication, protecting family time, keeping structure and routine, and that optimizing and organizing supports can be really a helpful tool for families during this time, and sometimes may require a professional component. So that's all of the formal part of the conversation, and I tried to leave some time for questions, so we'll open it up. Yeah, please come up to the mic so our at-home viewers can hear.
Is there research for parents about what happens to children after a parent dies, and is that in a form that can be accessed by parents? Also, do you know about a body of literature or writing by children who lost a parent or things like that, so that we might gain insights into how to support that way?
Sure, absolutely. That's a great question. And given that you're at the mic, I won't repeat it. But basically, thinking about how children fare after the death of a parent. And what some of the research shows is that some of it is dependent on how it's handled going through the course of the illness, and that's why we talk about some of these things, and that's why I kind of mentioned the difference between challenge and trauma. So if a child is well supported and the parents are able to garner their support and aren't in a lot of distress themselves, then children often do better. Some of the research looks at parental distress, and that's often during the course of an illness one of the predictive factors for childhood distress. And I think kind of preparation and legacy leaving and all of these things that are involved with a parent's death are also important factors for children. So in terms of the body of literature, and there's more about this on the website, the mghpact.org website, and probably Wonders and Worries has some of this. mghpact.org, that was at the beginning, and wondersandworries.org, if I'm correct, right? It's just like it sounds, Wonders and Worries, all one word.org. Their website probably also has some, and if not, you can contact them and they'll direct you to some of it. In terms of literature written by children, I mean, I've certainly seen some of it doing some of the work, and there are some postings of it. I know of at least one on the PACT website. I don't know if Wonders and Worries has kind of a collection of that, and there are some books, even children's books, from kids who have gone through some of this, and they kind of write to other kids. There's a family that was helped by the PACT program, and they every year now host a holiday gift exchange that the two kids who lost their parent but we're so kind of moved by the whole process, and we're helped along by the parents through it. That was one of the ways that they coped with it, is they kind of decided to help other families with it. So kids who go through this are obviously very affected and moved, and do often produce something like a body of literature, an essay. Some people write their college essays about it and all of that. So it's out there. I think finding it is a challenge, but Wonders and Worries and the PACT program will probably give you some specifics about that. Yeah, please. So everyone, this is Kim from Wonders and Worries.
Hello. I wanted to add to that too, and just say that research definitely shows that the time prior to a loss, this time during illness, is even more stressful for children than the period following a loss. And I just want to reiterate everything that Vaughn shared, because we've met before and are definitely on the same page and have mutual respect for each other's just backgrounds and programs. And so you all being here and the things that you're doing to set that foundation, as Vaughn described, for your children, it makes all the difference in their ability to cope long-term with whatever may come. And I have had children tell me, I can think of one 8-year-old little girl, we were playing a game, and the question was, what's one of the worst things that can happen? And her father had died, and I thought she would say that you lose a parent. And what she said was, if you were to lose someone you love suddenly and not have any preparation for that. And so in her 8-year-old mind, having the opportunity to prepare for the loss and have some time to say goodbye and have some closure made a huge difference in her ability to cope. So I just wanted to add that. And then I just wanted to mention for all of you and viewers at home that Wonders and Worries is a resource, a free resource for both parenting support and individual support and group support for children facing a parent's illness. We don't have to meet directly with children, and for those viewers who aren't in the Austin area or in Raleigh or I'm totally blanking. I can't believe I'm blanking on our other place where we have Wonders and Worries. I'll come back to it. But if you're not in a place where we have an office, we can provide online and phone support. And of course in the Austin area, in-person support. And all of our support is free. So we appreciate the opportunity to share that with all of you. Thank you.
Yeah, absolutely. And there's a book that talks about a lot of these principles also in more detail, even more detail than the website does, which is called Parenting, I'm having the same blank. Raising emotionally healthy children when a parent is sick. So, and that's by Dr. Paula Rausch and Dr. Muriel. So, raising an emotionally healthy child when a parent is sick.
So we have a couple of questions from our online viewers. The first one is, this person has recently been diagnosed with cancer and has not talked to her child about this.
Yeah.
However, the daughter is 4 years old and has recently lost a great aunt who got sick, lost her hair, and then eventually died. Mm-hmm. And so this parent is concerned about, how do I explain to my 4-year-old about chemo, because she's worried that as she sees her mom lose her hair, that she thinks her mom is automatically going to die. Yeah.
So that's a great question. Thank you for sharing it. I think it's also a common one that we're asked often when a child has had an experience with another loved one who they have seen get sick and perhaps pass away. How do we differentiate that? And that's really one of the reasons that we want to start talking about it early on, and to use different words and to use kind of the specific type of cancer. For example, if your cancer is different than the great aunt's cancer, that's an important distinction to make that will help a 4-year-old especially say, well, this is different. And so they won't automatically assume to rush toward that this is going to happen, and actually to come right out and say, I know that great aunt so-and-so, you saw her get sick, she had cancer. I want you to know that my cancer is different. And even if it's the same kind, my body is different than her body, and the same kind of cancer is very different in everybody's body. So right now, what I want you to know is we're tackling this. I found, again, I'm working with the best doctors I can, taking the best medicine. We have a plan, and no one is worried about me dying right now of this condition, and we'll kind of, how can I keep you up to date so that she knows about that. I think in a keeping it again at a 4-year-old's level, sometimes they want to know what cancer is to start with, and that can be a hard thing to explain to a 4-year-old. That goes back to age appropriate, and I meant to actually share this example during it, that with the diagnosis of cancer, sharing it with kind of preschool and school age kids, often being really concrete and thinking of a real life example that could explain it is really helpful. So sometimes parents like to use the garden metaphor, like, we all have parts of our body that are really important and do things that we need them to do, like the flowers in a garden. But sometimes things start growing in the garden, like weeds, that aren't supposed to be there and actually can kind of push out the flowers that are supposed to be there. So one of the things that my doctors want to help me with is pulling those weeds out, and how do I get them out? Another thing that is sometimes, if kids aren't into the flower or garden metaphor, I've used is, our body's made up of building blocks like bricks in a house, and in one corner of a room, if the bricks started growing and growing, and that's what happens to our building blocks when they get cancer, they just won't stop making new ones, and it can start filling up the living room and then start pushing out the couch and pushing out all that stuff that's supposed to be in there. So we want to stop that growing from happening and take out some of the bricks that aren't supposed to be there and put the furniture back where it's supposed to be. So those are some ideas for younger kids. Anyone else have a question? Okay.
So the next person online who asked a question says that while their child was too young to remember the treatment that the father went through, he's likely to be living with cancer as a long-term illness. Mm-hmm. And they're wondering about how to have that conversation about how, while scans and doctor's appointments and medications are probably going to be always a part of their life.
Absolutely. So kind of talking about once the active phase of treatment is over and you're in remission, which is often a great thing, but surprisingly often in remission there's still a lot of stress because of these very things, that there's a lot of roller coaster riding, as I call it, because every time you're going in for one of those checkups, there can be stress before it. And the kids, just like they picked up on the initial stress, can pick that up, and changes that have to happen based on schedules because of doctor's appointments and everything can be there. So really it's the same principles that I talked about guiding you through the course of the active phase of treatment that we can use during the remission phase, which is to really speak openly and honestly about it, let them know that this is the case. I think reassuring them that no one is worried, just because I'm going back to the doctor now for a checkup, no one thinks I have it. I'm going there proactively to make sure that it stays away. And kind of giving explanations like that is often a helpful thing, and trying to do it predictably and keeping the routines and everything is important.
Can I share an analogy?
Yeah, please do.
One analogy that I really like along those lines, and it's in a book that's meant for older school age and young adolescents. It's called Nana, What is Cancer? And it talks about the idea of chronic cancer as a tiger in a cage, and talking with children about the analogy that if you go to the zoo and you see a tiger in a cage, how does that feel? Is that a scary thing? Well, not really. It's something you can be curious about, you can learn about it, you can understand that it's a safe situation. But if that tiger were to get out of that cage, well, then it might be a little scarier situation, and people might need to work together, would need to work together to get that tiger back in the cage. So chronic cancer can be approached in that way with children, that our goal here is, nobody believes that we don't know a way right now to completely get my body to be cancer free. There's this cancer that's in my body and will probably be there maybe forever. But as long as we can control it and keep it in one area and then watch and make sure it stays in that cage, then I can continue to go on and living a healthy, happy life.
Absolutely, that's great. Thank you. Yeah.
This was the last one we have from our online viewers. So this one is a parent who, I'm assuming, but this person has cancer his or herself and has a 5-year-old that just will not talk about it. I guess it sounds like they've been trying to have some conversations. And the question really is, do I push it, or do I let him guide what to discuss? That was the question.
Yeah. So that's a really good question. And at 5, it's certainly challenging to determine. I think one principle is that they need to know the basics, just like we talked about in terms of the honest, age-appropriate information. So if they have a hard time talking about it, at least so they know what it is, and you know that they know what it is, and they know what's going on, that is a good place to start. I think, in terms of pushing a lot on them and kind of continuing to bring it up can be upsetting to a child and actually can increase their stress level and their distress. So pushing it is not a great idea usually. That being said, I think finding a way to communicate with your child. So how have they dealt with things that have been hard in their life before? How have you talked about other hard things to them before or communicated with them? Are different settings easier to talk to them about? Is it one-on-one? Is it at night before bed when they're more relaxed? Or maybe that's not such a relaxed time with the 5-year-old and there's another time of day that is. So just making sure that they have the basics can be really important. And then in addition to that, how do you know if they're not talking a lot about it, how they're doing? And that really, what speaks the loudest is how they're doing generally in life. Do they seem to be staying on their developmental trajectory that other 5-year-olds are doing and doing the things that 5-year-olds are supposed to be doing? Are they playing? Are they laughing and having fun? Do they still want to be with their friends? Are they eating okay? And are they sleeping regular hours? And are they going to school and adjusted well and bringing home their homework and doing it? And all the things that they should be doing. They're hopefully not too much homework at 5, but little sheets sometimes. But doing those things that a 5-year-old should be doing is a good thermometer when they're not giving you a lot of verbal feedback. Sometimes also setting up, just to follow up on that, setting up to kind of check-in times that, okay, I know you don't like to talk about this and it's hard for you. Well, maybe we'll do it on Saturday mornings when we get donuts or something like that. Kind of setting up intermittent check-ins where you can give them information can sometimes be a useful thing for some kids. And also, one thing that I should have said to start with is checking with them if they can tell you what about talking about it don't they like. Because it might just be like, well, I'm afraid I'm going to cry in front of you, and you can reassure them that that's okay. Or you could even say, sometimes I do this with my patients that are unrelated to cancer but have a hard time talking face to face, is like, if I look away from you, would it be easier for you to talk about this? And sometimes that simple trick makes a difference. So keeping the kid in mind themselves. Yeah. No, it's fine. That's what I'm here for.
So this person on our online audience is hoping to educate people who work with parents, such as teachers, school professionals, folks of that sort, and wondered if you had any particular advice for what they might say to that audience. Yeah. So in specific to their child or in general, do you know? I think they were trying to educate people in general, not specifically. Yeah, because they said they were trying to work on like an education module for those types of professionals. Oh, okay. Well, I think one of the things to keep in mind is that all of these ancillary supports are useful resources. However, we don't want it to take away from what the parent is trying to do. And if the parent is providing some of that essential support. And so one of the guiding principles will be to really talk with the parents about some of these things, and some of the principles that are really important, and to help parents to support their kids directly through some of these principles. I think in addition to that, knowing signs to look for, some of those things about, when does a child need more help and where to go are really important for ancillary supports to educate themselves about. And knowing that they can alert a parent if they're witnessing things in an ongoing way with their kids is really important. So, and there's, I'm sure, more detail that we could get into, but I think we're limited on time. So, okay, great. Well, thank you for your attention and for the great questions online. Thank you to our home audience as well. Thanks everyone for attending here in person, and thanks everyone who attended online. Thank you, Dr. Mankey. Thanks.